We go any further, what's your take on the vaccine that has been launched in Lira?
Okay, so
the HIV vaccine.
The Nakapavir vaccine.
Yes.
Yes, as you can see, on the goal of ending AIDS, one of the preventive measures that have been put, as you've said, we have had the measures of abstinence, and we have had the measures of condom use, and people have been told to be faithful.
Okay.
But now this vaccine brings in a new force of prevention. One may argue that this vaccine may encourage more of people having unrestricted sexual behavior, since they have a vaccine available.
Yeah,
but
sure.
like we have seen by the Ministry of Health emphasizing that this vaccine is not only about, it's not eliminating the other modes of prevention,
yes.
but rather it's reinforcing the prevention measures.
Yes.
So I urge all Ugandans to take up this, because it's a high profit measure in prevention of HIV/AIDS.
Okay, so thank you very much, and we are going to have a very important discussion about malaria and moving forward. But before we head there, let's take a short break and then we come back.
Are you ready to build real skills for a better future? Tune in to Skilling Uganda, the show that empowers, educates and transforms lives. From hands-on vocational skills to expert guidance and real success stories, Skilling Uganda connects you to opportunities that matter. Every Monday to Friday, 9 a.m. to 11 a.m. Don't just stream it, skill it. Skilling Uganda, shaping Uganda's future, one skill at a time, only on TV1. See the difference. A clean environment begins with us. Go Green is the program dedicated to inspiring communities to protect nature, promote proper sanitation, and build a healthier, greener future for everyone. Discover practical ideas on waste management, environmental conservation, tree planting, and community sanitation. Because when we respect nature, nature sustains us in return. Let's work together to keep our surroundings clean, safe and green for generations to come. Every Sunday, 3 p.m. only on TV1. Go Green. Small actions today for a greener tomorrow.
As we had left off, we are still joined by Dr. Ronald, who is going to help us and teach us and also make us understand what exactly is malaria and how can we protect our families. So doctor, to start off, let's begin with the basics. What is malaria and how is it transmitted?
Okay, thank you. So malaria is one of the diseases that is very common. It's one of the diseases that causes fever in human beings. And it's an infectious disease, meaning it can be transmitted from one person to another. And this transmission is through the vectors, which are malaria parasites. Yes, so these parasites are carried by mosquitoes. And these mosquitoes breed in our homes, breed around the bushes. So these mosquitoes, and mostly it's female anopheles mosquitoes, so these carry the malaria parasites, and they transmit the parasite from one person to another. So once one person is infected, another person, provided the mosquito bites another person, the person can be infected as well. So it's a transmissible disease, and yes, but also what we should know, malaria is preventable disease.
Okay.
Yes, a preventable disease and as well as a treatable disease.
Yes. Okay, so doctor, what's the global burden if you are to look at the epidemiology of malaria? What's the global burden? Are we in the states of not being so much spread nowadays? Are we increasing or decreasing?
Okay.
Yes.
Thank you. I understand. Yes. So, and in 2024, Uganda under Ministry of Health launched a national malaria elimination intensification strategy.
Yes.
And this is to run from 2024 to 2030.
Okay.
And this is because for the previous years, actually, Uganda had registered an improvement in malaria eradication.
Okay.
But from the statistics, we know that in Uganda, malaria is the highest, is the leading illness.
Cause of many deaths.
Cause of illness and also death.
Yeah.
Yes, in hospitals. So that means even when we see an improvement in prevention, there is still a big burden.
Okay.
And malaria, as per 2024, we registered about 2,790 cases. That's an incidence which was high.
Yeah, sure.
In 100,000 cases, that was high. And actually, we see that the incidence of malaria, the prevalence of malaria up to now is still high.
Yes.
We are over 12.5 to 13%. In other words, in 100 people that we see, 13 people have malaria. So that's a big number for an illness that we know causes very many complications.
And can be prevented also.
Which can be prevented.
Because, doctor, why do you think it's still common among our communities, among our people?
Malaria, I think it is still common among our people because one, we have gotten used to it, I believe.
Yeah,
so when people are told to implement these prevention measures, people don't take it so serious. Actually, they don't see malaria as something serious. You know, malaria is an endemic disease, meaning it is a disease that is with us.
Yeah, sure.
It's different from an epidemic which just comes out of the blue. So malaria has been around for years and years. So people have gotten used to this, and even when they are told that please do this to prevent malaria, do this to prevent malaria, they are used to it.
Yeah,
and
something common.
We don't take it as something serious. But actually, when people realize how bad malaria is, I believe they would easily put in effort to prevent malaria.
Okay, so when we talk about malaria, who is mostly at risk among the age groups?
Yes, malaria, we see that the people who are most at risk are the children under the age of 5.
Okay.
Yes, and actually that's the reason you see that the malaria vaccine was initiated first for children.
Okay.
And we began with the children under the age of 2. But the high risk is children under the age of 5. But also pregnant women.
Okay.
Yes, pregnant women, because in pregnancy there is some kind of immunosuppression. Yes, so pregnant women are always at risk.
Yeah,
yes,
sure.
That's the reason you see in prevention measures for malaria, pregnant women are high priority as well.
Okay.
So since this is also an infection in people with who are immunocompromised,
yes,
people living with HIV/AIDS, they are also at high risk.
Yeah, sure.
Yes.
So when it comes to this, what are the early signs or symptoms someone can look for? I know that I need to go to the hospital and check out with the doctor.
Yes, like I said, malaria is among what we call the febrile illnesses.
Yes.
In other words, it's among the diseases that causes fever. So one of the most common manifestations is fever. And we have a problem with that because everyone who gets a fever thinks they're having malaria.
And they go to the hospital and they only buy tabs.
They want tabs for malaria. Actually, in Uganda, people call malaria omusujja. But yet, in the real sense, omusujja is fever. So in other words, when someone has fever, omusujja, there are very many causes of fever. So people always mistake that and usually want to take fever as malaria, which is not right. So it's one of the manifestations, but it's not the only. Malaria is not the only cause of fever. So other symptoms that happen, we have headache.
Before we get there, now what's the term for malaria? If Omsuja is fever, then what's the term for malaria? You know, people maybe they confuse these things.
So the right term for malaria in Uganda should be Omusujja gw'ensiri.
Omsuja gw'ensiri.
Yes, it is spread by the mosquitoes.
Okay.
Yes, as like you could have Omusujja gwa typhoid. It is Omusujja caused by, but Omusujja is fever.
Okay.
So malaria is Omusujja gw'ensiri, but not necessarily Omusujja.
Yes. So we're continuing with the symptoms.
Yes. Sometimes, like I said, now to be clear, symptoms can be non-specific. So someone should not say, if I have headache, I have malaria.
Okay.
But presentations can be common in actually very many diseases. But some of the other symptoms that happen, we have general body weakness, muscle pains. Actually, people present with myalgias.
Okay.
People can actually present with joint pains. Sometimes people can have abdominal pain. Now these are the beginning symptoms: diarrhea, vomiting. So these are some of the beginning early symptoms of the illness.
Yes.
Yes. But after that, the reason as to why I say people should take malaria serious is because from the beginning of the early symptoms, this disease can progress from being a simple, uncomplicated illness to a severe illness.
Yeah, sure.
So actually, malaria can proceed and progress and become a severe condition.
Okay.
And that's when you actually find someone collapsing because of malaria.
Yeah, sure.
Yes. And we find people having altered mentation, is no longer understanding and is confused just because of malaria. Actually, people can have severe anemia. The blood can go too low.
Too low,
Yes. Malaria can go ahead to even damage kidneys, causing acute kidney injury.
Yes.
So, yes, so this is something because it can affect even almost all other body organs. Can go to the brain, and can affect cerebral malaria, can have acute kidney injury, can affect the lungs. Someone presents with acute respiratory distress syndrome. This very shortness of breath is breathing very poorly, just because of malaria, and the lungs are full of water, if I can say in simple terms. Yes, so it can go from an uncomplicated illness to a severe illness. Okay. But the symptoms are non-specific to only headache and fever. Yes.
I think the problem we have there is people mixing up the symptoms and the signs. Yeah, people mix up the symptoms and the signs. They're like, I have headache, I have stomach pain, I have joint pain, and they're like, maybe this is not malaria, maybe this is typhoid. What's your take on that?
Yes, my take on that is
everyone, my name is Quinker Prayonidas Noella.
My name is Nachma Friends Ella.
My name is Kulmuma Abigail Emmanuel. Welcome to UG Kids on TV1.
From beautiful poems and reading to energetic dancing and singing,
every Sunday from 10 a.m. to 12 p.m. UG Kids lights up your screen with amazing kids just like you.
What is a room that has no doors or windows?
UG Kids is a show where youngsters shine, creativity grows, and learning feels like play. So gather your friends, call your family, family and tune into the show that celebrates talent, confidence, and fun.
Yogi Kids on TV1.
See the difference.
Don't miss on
He who
TV1.
controls the printing age and the printed page controls the thinking of the next age and the next generation. Oyo yenna afuga ebiwandikibwa ku bitabo n'ebiwandikibwa ku page mu kaseera ako yafuga endowooza y'omugigi ogunaddako ogusoma kwe.
Welcome back from that short break, and thank you for tuning in. From where we had left off, we were still talking about other diseases having the same symptoms and signs with malaria, and wanted to know more about your take on that.
Oh, thank you. So actually, if you, according to the statistics,
Yes.
we realize that out of about 10 people that come in and as outpatient coming in on hospital just to be checked out, they're not feeling okay.
Yes.
You can find 3 to 5 of them are malaria patients.
Yeah.
But like you said, very many people say, the moment I have fever, the moment I have headache, I have malaria.
I have malaria, yeah,
but
sure.
science, if I can say medicine, is based on evidence.
Yeah.
It's not about assumption. So,
what you think.
Yes, what you think. That's why I say the symptoms should not tell you that, yes, I have malaria. We base on confirmation
Okay.
to confirm that this person, yes, has malaria. That's why there is always what we call laboratory tests.
Yeah.
Now, these are things that people don't want. That's why they can easily go to over the counter to get medication, just out of the blue, get medication, have this medication. But people should appreciate the fact that medicine moves with confirmation.
Confirmation.
Yes, if you have fever and you think you're having malaria, come to the hospital, come to the health facility. You're supposed to be tested, and we're supposed to confirm that you have malaria. Otherwise, you will treat malaria, yet you have something different. And actually, yes, you will take some pain relievers, you take some medication to take away the fever, but yet, actually, the real problem is still there. So it is based on confirmation by testing. And in Uganda, under the elimination strategies, we see that the government made sure there is a rolling out of easily accessible rapid diagnostic tests. These are the ones we call the MRDTs. Yes, because they are simple and very accessible and very fast, quick results. And these can give you a confirmation whether you have malaria or not. Now, to note that this for the malaria cases, like I said, we have a species that is very common that causes almost 97%. It's called Plasmodium falciparum. So this is almost responsible for 97% of the cases. So these RDTs were developed having an ability to detect this antigen. So and actually on the rollout, more RDTs were developed to detect the other forms of this plasmodium. But we also have another test which we call a blood smear. This is where the medical professional goes into a microscope to see whether you have malaria parasites in your blood. So it is very important for someone to go to a hospital, to go to a health facility and be tested rather than getting over-the-counter medication.
So doctor, from there, at what point should a person seek medical attention for malaria? Yes. One of the problems you have with eradication is people stay with the disease for long, and actually over the period they keep on spreading it to others before they get medical attention. So according to World Health Organization, in 24 hours, when someone has a fever, it is best, if at all it's confirmed, in those 24 hours, it's confirmed that you have malaria, you should be having treatment. In other words, when you have a fever, go and test. Test and check. Yes, exactly. So doctor, what are some of the danger signs? The danger signs of malaria. Now that question is tricky because, in other words, if I don't have the danger signs, it's very easy for me to keep home and wait. Since I'm just having a headache, I'm just having a fever, so there is no need to worry. I'm still in an occasion, and then you wait for the danger signs. But still, some of the danger signs where we now say this person, the malaria is progressing to severe malaria. We call it hyperparexia, where the fever is now increasing. You know, we have grades where the fever is low and now it's increasing. The person, the temperature is too high. So now we're starting to think the malaria is progressing to severe malaria. The other sign, now this one can only be known after testing in a microscope, is when the parasites are increasing in number. Still, you can't know if you're not tested. One of the other symptoms is also you can't know without testing, is hypoglycemia, whereby your blood glucose goes too low. So even your brain is not getting enough glucose. That's when people collapse, and people are like, just malaria is making someone collapse. Because the blood sugar has gone too low and the disease is progressing. Other symptoms, sometimes I reached a time and they used to call it black water urine, where a person passes out dark urine, which is tea water, like tea water, and it's the urine coming out, and actually it progresses, can even progress to blood urine. Now that's when you know that even the kidneys are getting affected. Yes, so these are some of the signs that the disease is progressing. Difficult in breathing, that means now the lungs are also getting affected. Water administration, you're getting confused, collapsing. So these are severe symptoms. So doctor, you talked about malaria being a disease that can be transferred from one person to another. So how does that happen?
Yes, how that happens. Now, this mosquito, if at all it bites me, that has a disease, because when the mosquito bites a person, it can take roughly in 2 weeks' time.
Okay.
In my body, cycles are happening, which we cannot go over right now. Cycles are happening where these Plasmodium species are moving. They're reproducing, going into the blood, going to the liver, going to the brain, going to the red blood cells. So it reaches a time and they are disseminated into the blood.
Yeah, sure.
So now I have the disease. Now, provided the mosquito bites me and bites another person, it transmits that vector, it transmits that Plasmodium species to the other person.
Okay.
The moment it's transmitted, these species always reproduce. They produce different components that still now disseminate in the blood system of this person.
Okay.
So it can take an incubation period where you're okay, you have no problem, but the disease is disseminating, and that's when the fever now comes in, the headache comes in, but it has taken some days.
Okay.
Yes, from the bite.
Okay, so doctor, let's go straight to the causes. How is malaria caused? You know, people know these things, but maybe they need to understand more how malaria is actually caused.
Yes, how malaria is caused.
Yeah.
So, because the causative agent is the Plasmodium species that I talked about, which are carried by the mosquito.
Yes.
So it's just a cycle. It's provided the mosquito bites an infected person, it's going to spread. So in other words, provided you create environment for mosquitoes to grow around, to reproduce, to live.
Okay, can we go a bit deeper in that, the environment you're talking about?
Yes, the environment I'm talking about, because these mosquitoes, they breed mostly in the night.
Okay.
Actually, in the evening hours and then early morning hours.
Yeah, sure.
That's when they breed mostly. And actually, that's when they're even active.
Okay.
That's when even the biting happens. No wonder people are told to sleep under
treated mosquito nets,
because at night these mosquitoes are very active. In other words, you can even call them nocturnals, because at night they are very active. Yes, and they breed so much in cold environments.
Okay.
So in other words, you're having stagnated water around the home, you're having bushes around the home. Rainy seasons are also one of the main issues. So that's why we have seasons where we have peaks of malaria incidences, because in rainy seasons and then the times after the rain, the cold environments. So that's when these mosquitoes breed easily.
Okay.
So provided you're creating a cold environment, you're creating a bushy environment, you're giving these mosquitoes time to breed and live freely.
Okay.
Yes.
So you've talked about those causes. What do you think the problem is with our people here in Uganda, most especially the people living in the urban centers? Because they know some of the bushes are not there, but they're still getting malaria.
Yes.
What do you say about that?
Yes, so in urban centers where there are no bushes, actually, you realize one of the problems that comes with urbanization is congestion.
Okay.
And then I think you see that the government of Uganda is just trying to improve housing, because poor housing, houses with poor aeration, which are common in urban centers, in urban slums.
Okay.
So with this poor aeration, it is also one of the major causes. So you may not see bushes around, but in slums, stagnated water is all over the place. Move around Kampala, you will see stagnated water all over the place. So you move around the slums. So all these are breeding areas. So poor aeration is one of the problems in urban areas also.
Okay. So our dear viewers, we are going to be having calls from you, receiving calls from you. We have Dr. Roland Kamyuka with us in studio. He is going to be answering your questions, and also you can send in your messages via that line that has been placed on your screen. So be sending in the messages, because we shall be answering them. And so, doctor, to move forward, what is the best way people can prevent themselves from getting malaria?
The best way. Now we can't say that this is the best way because we have very many measures, and these measures are supposed to be put in order, and they're supposed to be used in conjunction. So in other words, you shouldn't say, since I'm doing this, I should ignore the other. Yes, so we're having very many preventive measures, and one of them is to first combat the vector itself. Yes, to first prevent that mosquito from moving. That's where the insecticide nets come from. That these treated insecticide nets act as a barrier. Yes, the mosquito cannot pass through, and also can even die from the insecticide treatment of these nets. So one of them is sleeping under treated insecticide nets. Yes, and the other, still, we're having all over the market currently, we're having very many mosquito repellents around, actually. So it's a very big innovation that has come up to help in repelling.
But do they even work?
Actually, and we also have indoor display, and this the government has put it in place, and very in high high risk populations.
Yeah.
So we have what we call intermittent preventive treatment. So the pregnant women are always given malaria prevention.
Yeah.
Yes, and actually starting from the second trimester, they always get malaria prevention. And since people may not take it serious, so actually it is called a directly observed treatment. So it's when the mother comes for antenatal care, they're supposed to take that treatment there and then when the health worker is seeing.
Yeah.
So now we have a problem with mothers if they don't go for antenatal care because they're supposed to get this, the intermittent preventive treatment, because it is one of the chemo prevention measures. So even in places with high transmission, we have there is enrolled out a program of seasonal chemo prevention, seasonal malaria chemo prevention, because for the areas that are known to be highly endemic and having high transmission networks. They always chemo prevention. They are given tabs, medication, even when they don't have the malaria, but to prevent. Yes. Now another good measure of prevention is getting prompt treatment. Yes, getting tested and getting prompt treatment, early treatment, because when the person gets delayed treatment, they are spreading to others. That's why we said, you have a fever, go and get checked up, and still don't go for, I have come to test for
malaria.
Because you have said there are very many febrile illnesses. So if the malaria is not there, are you going home? So you should, you're supposed to give the health worker time to assess and confirm what is the problem with you. So getting tested and confirmed and getting treatment in time, you're reducing the chances of another person getting this malaria. Yes, so these are some of the prevention measures. And like we have seen in the highlights, that the government rolled out a vaccine last year in April 2025, and this vaccine was started with children under the age of 2 to increase the chances of prevention. Yes, prevention of this malaria. So these are prevention measures. So you can see that with these initiatives, we are trying to maximize all opportunities we have to prevent the disease.
So, Doctor, what is the role of nutrition in prevention of malaria?
Yes, of course. Now, nutrition is one of the ways of improving the immunity of a person. So, in other words, with good nutrition, the person is improving their immunity. Yes, and with improved immunity, that means actually the body can fight over this infection, if at all it's not a severe infection, of course. Yes, so nutrition is key for any disease, because the body is being equipped to fight against any disease that comes its way.
Yeah, sure. Okay, so Doctor, does malaria resurface after being treated?
Okay, yes. Now currently we're having a problem of what we call relapses. Yes, relapses. We're having a problem of what we call resistance also. So even after treatment, we have some forms of these parasites that stay in the liver. So in what we call, in simple terms, they are forms which they are not active forms, inactive forms. So even after treatment, after some time, the person has a relapse and actually will say, I wasn't treated, or I was given a wrong medication. So we're having relapses of malaria, and these are common in Plasmodium of vivax and malaria, but not so common with this common form that we have been talking about, the Pyrosporum. So relapses are common, and that means, it doesn't mean you were not treated right, but rather we're having forms that can cause relapsing fevers. Yes.
Okay, so Doctor, is there a possibility of malaria failing to heal even though the person is given the treatment?
Okay, yes, in treatment, guidelines in Uganda. We have what we call uncomplicated malaria and we have severe malaria.
Yeah.
Yes, so for uncomplicated malaria, that's when you come and we, according to the tests, we have confirmed it's not complicated. We give you oral medication and you go home, which people don't want these days. People, when they are not given IV medication, they don't think they are treated. Yes, but these are guidelines based on research, based on evidence, and we are sure that this treatment works. But with severe malaria, it is possible to get oral medication and the person has not healed, and this the plasmodium has not been cleared. So that's when we test and actually see that after the course of treatment of 3 days, the parasites are still there. And that's when the guidelines still confirm that there is need of adjusting. Yes, and there is always what we call first line and second line. Provided the first line has not worked for the patient, after completion of the dose, that's when there is need for going for the second line. So it is not right for someone to say I'm not healing before completion of the dose. Yes, but with severe forms, that's when we go to actually IV medication. Yes, where the treatment is given in the vein, intravenous. Yes, to administer a more stronger drug, if I must say. Yes.
Okay, thank you very much, Doctor, for that wonderful insight. And as we are concluding, please give us what's your call to action. And as we saw in the headlines and in our news, we are approaching the World Malaria Day, as published by the WHO on 25th of April. What's your call to action to people? What message can you give to people watching us?
Yes, the message I can give to the people who are watching is that malaria prevention and elimination of malaria starts with me and you. And it's a cohesive effort. In other words, it's not an effort that should be left to health workers alone or to the government alone, but rather communities are supposed to be involved. Religious leaders are supposed to be involved. And I thank TV1 for hosting this show, for making people aware of this disease, because these are measures to make people aware and know how they can prevent and they can best manage this condition. So malaria is treatable and it's preventable. As you've seen in the highlights, we have countries that have been registered malaria-free. So in other words, it is possible. And it starts with you and me.
Okay, thank you very much, Doctor. And our dear viewers, thank you for tuning in. As we have seen, malaria is common, but it should never be taken lightly. Also, early testing and proper treatment and prevention can all make a difference. So let's protect ourselves and our families and also our communities. So I have been Kaites Elizabeth, and this has been your health show. And let's meet again tomorrow, same day, same time. See you then.
Mu mutima gwa Uganda mulimu ekimera ekyenjawulo era nga kijiddwamu omutindo ogusukkulumye. Engano ya jiko